Bismillahirrahmanirrahim. Assalamu alaikum dear students. Today we are going to move on to the next chapter which is concerned with the cardiac output and venous return. But cardiac output has already been covered by Dr. Hamid in your previous lectures. So in this lecture we are only going to discuss the venous return. So, venous return is the rate of blood flow back towards the heart from the periphery. So, what happens is, suppose this is your heart and these are the four chambers. This is the right atrium, the right ventricle, the left atrium, and the left ventricle. So, the blood which is pumped from the left ventricle to the peripheral tissues, and then it completes its circuit and comes back to the right atrium of the heart through superior or inferior vena cava. This blood which is entering the heart in the right atrium through the superior inferior vena cava is known as the venous return. And please remember that the venous return is directly proportional to the cardiac output. The amount of blood which is coming into the heart is directly proportional to the amount of blood which is being pumped out of the heart during each beat. So, venous return is directly proportional to the cardiac output. So, it is also the most important determinant of the cardiac output. According to the formula, venous return is equal to the mean systemic filling pressure minus the right atrial pressure divided by the resistance to venous return. So, do you remember what is mean systemic filling pressure? As I told you in the previous lecture, to calculate the mean systemic filling pressure, you have to suppose this is your heart and this is your systemic circulatory tree. Here on this side are your arteries and these are your veins. So, if you stop the heart and you allow the blood to be equally distributed in your circulatory tree, and then when you see the pressure which this blood exerts on the vessel walls, this pressure is known as the mean systemic filling pressure, and this is the pressure with which the blood moves back towards the heart. So it is the most important determinant of venous return. Mean systemic filling pressure is around 7 millimeter mercury in the systemic circulation, and it is directly proportional to the venous return. Greater the mean systemic filling pressure, greater will be the venous return. And this mean systemic filling pressure depends upon two factors. This mean systemic filling pressure depends upon two factors. One factor is the volume of blood. Of course, if the volume of blood is greater, this pressure which is being exerted on the vessel walls will also be greater. Second factor on which the mean systemic filling pressure depends is the tone of the vessel, the tone of the blood vessel. So the first factor on which the mean systemic filling pressure depends is the volume of the blood, and the second factor is the tone of the blood vessel. If this vessel is constricted, the pressure or mean systemic filling pressure in this vessel will be high, and this will increase the mean systemic filling pressure, which will in return increase the venous return. So the venous return is directly proportional to the mean systemic filling pressure, and mean systemic filling pressure depends upon the volume of blood and the tone of blood vessel. Secondly, we have the right atrial pressure. Greater the right atrial pressure, lesser would be the venous return. As you can see, there is a negative sign with the right atrial pressure. So what is venous return? The blood coming back to the right atrium through superior and inferior vena cava. If the pressure in this right atrium is very high, of course the blood which is trying to enter the right atrium would have to face large or higher amounts of pressure, and the volume or the venous return would decrease. Secondly, we have a denominator over here, which is the resistance to venous return. It is also inversely proportional to venous return. If there are obstructions, or if there are a high resistance to the venous return would decrease. So, to sum it up, venous return is the amount of blood which enters the right atrium through superior and inferior vena cava. So, what is it? It is the amount of blood which is coming back to the heart from the periphery. According to its formula, it is equal to the mean systemic filling pressure minus right atrial pressure divided by resistance to venous return. As I mentioned before, mean systemic filling pressure is the pressure of the blood which the blood exerts on the vessel walls when the heart is stopped and the blood is allowed to distribute equally into the circulatory tree. So at this point, when the blood exerts the force on blood vessel wall, it is known as the mean systemic filling pressure. It is of 7 millimeter mercury. It depends upon the volume of the blood and upon the tone of the vessels, and the greater the mean systemic filling pressure, greater will be the venous return. Then we have the right atrial pressure. It is the pressure which is faced by the venous return. Greater the right atrial pressure, lesser will be the venous return. And these are divided by the resistance to venous return. Of course, if there is any obstruction in the path of venous return, the venous return would decrease. Now let us discuss all of these properties one by one. So if you are asked a question about factors affecting venous return, you must mention all of these. As I mentioned before, the most important factor which affects the venous return is number one, the mean systemic filling pressure. And mean systemic filling pressure in return is affected by the blood volume and by the tone of the blood vessel. Secondly, we have the total peripheral resistance. It also affects the venous return. Then we have the skeletal and abdominal pump, the thoracic pump, the cardiac pump, the venous valves, the role of posture and gravity, the right atrial pressure, and the arterial pulsations. So let us discuss all of these factors one by one, but if you're asked about the factors affecting the venous return to the heart, you have to mention all of these factors. So the first factor we should study that affects the venous return is the right atrial pressure. As I mentioned before, that the pressure in the right atrium is 0 millimeter mercury, and it is also known as the central venous pressure. We have already discussed this in previous chapters. Why is it known as the central venous pressure? Because right atrium is the center of your venous system. All your veins drain into the right atrium. So the pressure in the right atrium is known as the central venous pressure, and in all of your venous tree or venous system, the pressure is lowest in the right atrium. So the blood can flow from your peripheral veins into your right atrium. So the pressure in the right atrium is 0 millimeter mercury, and this is also known as the central venous pressure. If this pressure is raised from 0 millimeter mercury to higher values, the resistance which is faced by the venous return increases, and the amount of blood which is returning to the right atrium decreases. You can see this in this graph, that when the right atrial pressure is around 0, your venous return is maximum. It is around 5.5 or 6 liters per minute. Then if you start increasing the right atrial pressure, suppose you raise this pressure from 0 millimeter mercury to 4 millimeter mercury, your venous return decreases to around 2.5, liters per minute. You can see the drastic change in the venous return when you increase the right atrial pressure. And if you increase it further to around 7.5 or so, the venous return becomes zero, that this pressure is not compatible with life. So for effective venous return, for the blood to return from the superior and inferior vena cava into the right atrium, the pressure within the right atrium must be zero, so there can be adequate venous return. So this is the role of the right atrial pressure in determining your venous return. So the second important factor which determines the blood venous return is the mean systemic filling pressure. So it is the pressure measured everywhere in the systemic circulation when heart is stopped and blood is equally distributed throughout the cardiovascular system. As I explained before, that if you stop your heart and you allow the blood to equally distribute in the circulatory tree, so the force which is to be exerted by this blood on the vessel wall is known as the mean systemic filling pressure. If you stop the heart, allow the blood to distribute in the circulatory tree, and then you measure the pressure which is being exerted by this blood on the vessel walls, this pressure is known as the mean systemic filling pressure, and its value is around 7 millimeter mercury, and this is the force with which the blood moves towards the right atrium. So this is the force which is known as the mean systemic filling pressure, and it determines the venous return. It depends upon two things: the volume of blood and the vasomotor tone. Suppose if some person experiences blood loss after a surgery or after an accident, and he loses around 1 liter of blood from his circulation, so the blood which is left behind is going to exert lesser pressure on the vessel wall as compared to the normal healthy person. So volume of blood is an important factor which determines the mean systemic filling pressure. The second important factor is the vasomotor tone. Suppose if a person is given a drug which affects his vasomotor tone and causes dilation of all his vessels, these vessels are now going to dilate and the pressure within them is going to fall. So the mean systemic filling pressure is also determined by the vasomotor tone. So this is the mean systemic filling pressure, and it is the most important determinant of venous return. So basically, what is the total peripheral resistance? Total peripheral resistance is the resistance faced by blood while it is moving through the circulatory tree, especially through the arteries. So if the arteries constrict and they do not allow blood to move from the arterial side towards the venous side, the venous return would decrease. So increasing total peripheral resistance would decrease venous return. Suppose here we put a clamp and we squeeze shut these blood vessels. Blood cannot flow from the arterial end towards the venous end, so total peripheral resistance decreases the venous return. Then we have the cardiac pump. Since the blood which is returning towards the heart is being pumped by the left ventricle and it is experiencing a force from behind which is pushing it through the circulatory tree, so if there is any disease or disorder of the left ventricle, the force with which the blood is being pushed from behind is reduced. So whenever there is a disease of the cardiac pump, the force which is pushing the blood along the circulation reduces and lesser amount of blood is returned back towards the heart. So the contraction of the left ventricle creates a pressure that pushes the blood from behind all along the vascular tree throughout the body. This pressure is responsible for pushing the blood from behind towards the right atrium. So if there is any disorder of the left ventricle, or is the left ventricle is not pumping properly, the force from behind on the blood reduces, and it cannot if efficiently pass through the tree, a circulatory tree, and reach back towards the right atrium. So any disease of the left ventricle would reduce the venous return. Then we have the thoracic pump. So as you know that your thoracic cavity is a closed cavity with diaphragm at the bottom, and this is your rib cage. So your heart is also present within your thoracic cavity. So every time you inspire, your rib cage expands as a closed chamber. Why? Because your diaphragm moves downward and your ribs move outward, and there is a suction produced in your thoracic cavity which allows the air to move into your lungs. Not only this negative pressure in your thoracic cavity causes the air to enter your lung, but it also sucks the blood from the periphery back towards the heart. So every time you take a deep breath and you inspire, your ribs move outward, your diaphragm moves downward, your thoracic cavity expands as a closed chamber which produces vacuum within your thoracic cavity, and this produces a suction effect in your thoracic cavity. And since your heart is present in your thoracic cavity, and due to the effect of suction, blood gushes from the periphery towards your right atrium. So your thoracic pump, which is your thoracic cavity, also acts as a suction for the blood. So when you inspire deeply, you pull the blood from the periphery towards your right atrium. So inspiration increases your venous return. Also when you inspire, your diaphragm moves downwards and it compresses the abdominal contents, your intestines and everything, and the blood is squeezed from your peripheral organs like your intestine and your other blood vessels which are present in your abdomen, and they are pushed towards your heart. This also increases your venous return. So negative pressure in the thorax and positive pressure in the abdomen increases your venous return. So your thoracic pump also plays an important role in increasing your venous return. Similarly, your skeletal muscles work as pumps. As I mentioned before, that your calf muscle, especially your soleus, when it squeezes or contracts, it pushes the blood from your peripheral veins in your legs back towards the heart. So your skeletal muscles act like pumps and they increase your venous return. This is the reason that if you keep standing for long time without contracting your muscles, it reduces the venous return to your heart and you may collapse. And that is why you are instructed that if you have to stand for a long time, keep flexing your leg, keep contracting your leg muscles so they can efficiently pump the blood back from your legs towards your heart. So skeletal muscles play important role in pumping your blood back towards your heart. Same is the case with your abdominal muscles. There are huge reservoirs of blood present within your abdomen. For example, your blood vessels of your GIT, your gastrointestinal tract, have large quantities of blood. The spleen, which is present in your abdomen, has large quantities of blood. Your liver has large quantities of blood. So whenever you squeeze your abdominal muscles, especially during heavy breathing or during exercise, the blood is squeezed from these organs and pushed back towards your heart. Also, especially when there is if there is a blood loss, the person is put in a fetal position with his legs compressing his abdomen, his legs against his abdomen, so that his abdominal pump can work and push blood from the abdomen towards the heart and increase the venous return. Next, we have the venous valves. These are structures which are present within the veins, and they only allow one way flow of blood from the periphery towards the heart, and they do not allow the blood to fall backwards towards the periphery. So as we already know that the walls of the veins do not have elastic tissue or a lot of smooth muscle, and they cannot contract efficiently. They depend upon their peripheral structures such as muscles to contract and to compress the veins and push the blood within the veins towards the heart. So when these muscles relax, the blood might try to fall backwards, but there are present veins which prevent the column of blood to fall backwards toward the periphery, and it only allows the blood to move towards the heart. So the veins have special valves which play very important role in preventing backflow of blood, so they also aid the venous return. Then we have the arterial pulsation. As I mentioned before, that veins themselves cannot compress or squeeze to push the blood towards the heart. They depend upon their neighboring structures. So you already know that muscles, when they compress or they contract, they compress the veins and push the blood towards the heart, but there are also present large arteries around the veins which, when they compress due to their pulsatile nature, push the blood in their neighboring veins towards the heart. As you already know, there are large vessels present in your abdomen and your thorax, especially suppose this is your vena cava, and around your inferior vena cava there is also present your aorta. And as you know that your vena cava cannot contract, but your aorta, descending aorta, which is present in your thorax and in your abdomen, because of high pressures it can expand and also it can recoil. So every time your aorta expands, it squeezes the vena cava which is present right next to it and causes the blood to move from the periphery towards the heart. So the pulsations of large arteries which are present around the veins also help to push the blood from the periphery back towards the heart. Then another important factor which helps in venous return is the posture and gravity. So as you already know that gravity opposes venous return. So if you are standing for a very long period of time, the gravity is going to pull your blood towards your leg, and if you keep standing for a very long time without moving your legs or compressing your calf muscles, the blood is going to pool within your legs, your venous return is going to decrease, and the blood flow to your brain is going to decrease. So such person who has been standing for very long, like the guards at the palace, at the Queen's Palace, if they keep standing for very long, you might have often heard within news that the guards of the Queen's Palace, they keep standing for very long periods of time without moving any muscles, and because of this the blood pools within their legs and the venous return decreases, the blood flow to their brain decreases, and these people are often, you can see in news or in articles, that these people tend to collapse. And when they collapse, this is in fact a defense mechanism of their body, that when a person is lying down, the venous return to that person's heart or increases. Suppose if this person is lying down, you can see that the heart of this person is at the same level as all other parts of his body. So the venous return increases towards the heart when the person is lying down. So this is a defense mechanism of your body. It makes you fall down so that venous return can increase towards your heart and brain. Also, if somebody is experiencing decreased blood pressure or decreased venous return, the person is asked to lie down with a pillow under his legs. So if you raise the legs above the level of the heart, it increases the venous return towards your heart. So this is the effect of posture and gravity on the venous return.